York Hospital currently admits approximately 500 stroke patients per year. The stroke team at York has recently extended its thrombolysis service to cover 24/7. This is supported by a full multidisciplinary team with research firmly embedded in it. Our vision here in York is to be able to deliver a 24-hour hyperacute stroke research service to mirror the thrombolysis service, and be able to offer all patients the opportunity to participate in stroke research. As part of the continued development and progression of stroke services at York, we're developing a patient-centred research service aimed at offering patients the opportunity to participate in research at various points along the care pathway. After much discussion and thought within the stroke research team, we have developed a tool called the 4 Ps of research. These are patient, pathway, protocol, and person. You need to know the patient pathway at your local area. You need to be able to identify where the patient meets that pathway. You need to have a protocol for where that patient meets the pathway. And you need a research nurse at the point the patient meets the pathway to be able to offer the protocol. Here in York, this is our pathway for stroke patients. The pathway can be adapted for other patient groups, for example, patients suffering from dementia or other illnesses. Currently here in York, we do not have any research trials that we can offer patients prior to admission, such as coming in the ambulance. However, there are trials on the horizon that may be able to help us facilitate this in the future. Here in York Hospital A&E departments, this is where stroke patients are first assessed for thrombolysis. This is where we offer patients the opportunity to participate in hyperacute stroke research studies. Currently here in York, we're able to offer patients the opportunity to participate in 2 hyperacute research studies, the Enchanted study and the TITCH2 study. Here on the acute stroke unit in York, we're able to offer patients the opportunity to participate in a variety of studies. The AVERT study, incorporating the entire MDT approach, the SOS study, and ENOS. Following on from the acute stroke unit, patients move on to the stroke rehabilitation ward. Here we work with the stroke MDT in offering a couple of studies, the DARS study and the FOCUS study. Following discharge, when patients return to the outpatients department for their follow-up, we can offer the podcast trial. When discharged home from the stroke service, patients that are participating in the AVERT trial or the DARS trial are followed up within their own home setting.
The 4 Ps of research places the patient at the centre of what we do here in York. Its concepts may be rolled out across the research networks. The 4 Ps of research are highly visible at the site, and it reminds us all to think in terms of patient, pathway, protocol and person. When we look at studies, we consider the patient pathway and how and where particular studies meet the patient pathway. This helps us to be in the right place at the right time. This way of thinking is recognised by the wider clinical team, and it's helping us to work smarter and manage performance better. We're creating a cultural change as we engage more with patients and clinical staff, and we've seen increased interest in what we do. Research is now being considered as an option for all stroke patients.
We believe that all patients should have the opportunity to participate in stroke research. And by working with the 4 Ps, it helps us to identify where patients need to have that research delivered to them. It also helps us to ensure that we have everything in place for that to happen effectively. Working with the 4 Ps will hopefully help us to widen participation in research and also help to deliver national objectives such as time and target.